Welcome to the
Hi
Bliss
guys.
Side Podcast.
Hello.
Hey, Janine, how are
Yeah,
you?
I am
You look
good.
windblown.
Yes, because I was literally flying back to
You just flew in,
Atlanta,
literally.
literally,
Yes, you did. Yeah.
and I felt like I was flying through the airport so I could
Yeah,
get back home, but it's no place like home, and it's no place like being here with you gals.
that's
Yes, gals.
right.
I say gals.
Mm,
Yeah.
Gals. Yeah,
It's
gal.
fine. It's fine.
This is Joja. We can say that.
Okay.
You
Okay.
know.
Cool.
Yeah, sure.
All right.
Yeah, right.
Yeah. Go. She, her,
Hey,
gal.
Kat. How you doing?
Hi. How are you
I
guys
got
doing?
me a little sniffle, so you're gonna see my trusty teepee over here going
That's all
like
right.
that.
I've had
Oh no.
post
No.
nasal drip for like 2 months, so I get it.
Oh, yuck.
Well, that's good.
Everybody's been sick
Cold.
for like the past 2 months. It's like they have a cough that just won't go away. The
Yeah.
sniffles that are just here to
Oh yeah.
stay. That
We had the flu for Christmas. It was a good gift.
Yeah.
Yeah, Merry
I'm
Christmas.
I'm
Oh
glad
yeah,
I
yeah.
It
got my
sucked.
flu shot this weekend. I'm feeling so much better today. No.
That's good. I heard it knocked you on your bugs. You got that plus COVID, right?
Yeah.
COVID shot
Oh,
anyway. Yeah,
I'm a
she
boss. I'm
did.
a thug.
How,
I'm a thug.
what is it? Just like you guys are like, hey, I'll just pay once, and like I don't get
Yeah.
it. I'm
oh
getting.
my
I ain't getting
Well,
it
God.
mixed
same
together.
arm. My arm feels like I got a tetanus shot.
I bet it
But
does. My
I
gosh.
just felt chilled and exhausted. That was it.
Yeah.
But this morning I still felt kind of weird, so I didn't go work out. And
Yeah.
but now I just I made a TikTok about my Rick James t-shirt.
I saw.
The Rick James T-shirt. Oh
I
my
can fit it
God.
again. It hasn't fit in 20 years.
That's amazing. That's amazing.
Or
I
I bought
love
my
it.
favorite top, and now I don't know if you guys know, but I'm obsessed with this top. Like
is
those
that
who
the
can
one that you
watch,
did?
I have it in every color they have. It
It looks
just got
nice.
restocked. It's
Oh really?
polar, my favorite tops. They're my favorite tops because they're oversized and they're straight size, so I can wear like regular human size clothes. Like you know what I mean, like regular, like you know what I mean by regular sized human, right? Like
Yeah,
the
like human
average.
size clothes. I get it.
Yeah, yeah, like
Yeah.
average folk. Like I can walk into an indoor store. Yeah, anyway, I like it. I love the pole stuff because it's just like super unique. And I have it in every color. So this season on the podcast, you're going to see this shirt in every color, including the pink one. Oh, I got two pink ones,
I
two
like
different
that
color
gray
pinks.
one that you
This is the green
modeled to.
one.
The
We love
green, there's a
pink.
gray
This
one.
is
It's nice
green.
too.
The
We
gray
love
one
pink.
I wore on last season. I don't care. I love it. Like that, that TikTok trend. Like if I like it, I'll buy it in a different color. Hey,
That's you,
it's
huh?
me. But
That's
I am
That's
pretty
you.
darn sure because when I bought it before and it was out of stock, it was actually a large, and I've since then lost 20 more pounds, and now I think I can wear a medium. So I think I'll keep the
Ooh.
large because I love it.
Ooh.
I know. But keep in mind it's oversized, right? So,
Yeah.
you know, it's just I love it. It's cute. Here's the thing, as a
Love
plus size lady, I find that there is just not a lot of like I feel like I walk into a room and if there's somebody else plus size, a lot of times we're wearing the same clothes,
True.
and so
Yeah.
I like the pull stuff that comes from the boutiques because I can wear it and I feel like I look more unique, and I'd like
Mhm.
to stand out for something other than my bootay. I want to look cute.
Like,
That's a
yeah.
good
Cute.
idea.
I want to look cute like the Kardashians cute. You know how they always say
Like,
that? You look cute.
there we go.
I just did a video for for those jeans, the good American jeans.
Those look
Yeah.
And
great.
I was like, you look cute. That's always what they say to each other when they see each other. Like, look
And
at
the
you with
vocal
your
fry.
glam. You look
I
The
know
cute.
they're
vocal
like,
fry.
oh
Yeah, like, you like,
God.
yeah.
Oh my god.
The
Right.
I
vocal
love
fry.
any
Yeah.
Kardashian trending sound. I think
Yeah,
they're
they're
just
funny.
hilarious.
I know. I do too. My husband hates that I do, but I'm like, they're so entertaining.
They are.
I didn't say I
They
don't want to
are.
be their best friends. I'm just saying they're very
Their
entertaining.
madness is just like,
Yeah.
oh gosh.
Yeah.
What are
For
they
sure.
up to now? Yeah.
Yeah. True.
Yeah.
Anyway,
Yeah.
so people that if you're new here, like go back and watch the first 2 seasons, please. Thank you. But if you want to stay, that's cool too. But
Yeah.
I'm Kim
We're more
and this
fun
is the
here.
Plus Sides podcast. I'm the founder and host or something, and Kat's the associate producer and host or something, and JT is a business development person and host, and that's what we do here.
It's a
I've
little bit of
struggled with
everything.
obesity since I was a little girl. Since I was 8. I was my first diet at 8 years old. My binge eating disorder, so I don't have to abbreviate it here. My binge eating disorder started there. A lot of disordered eating for me. And when I got to a certain dose of GLP-1 medications, my food noise turned off like a switch, and I have not had any binge eating anything in 17 months. And that is the longest I've ever
Amazing.
gone. It is life-changing. My obsessive anxiety is gone. And when you are sick your whole life and then you are better, all you want to do is shout about it. And luckily, there was a community here on TikTok and many people that were thrilled to do the same, you know? And so
And-
we're trying to get loud and change things on this podcast. We figure we'll be in the thorn of people's sides soon enough. We're a part of
Not
we're
already.
a part of a lot of we're a part of some telehealths
Soon.
and stuff, trying to change the way that, you know, our community is treated in healthcare going forward. We're trying to move some sort of needle. And in the meantime, we get messages that we're changing lives. So that's what we try to do here. And we're glad to have you along for the ride. I want to make sure that I get Kat an opportunity to tell her quick spiel, and JT too. JT too. Your spiel. Your spiel. No, it's like son of a
I've struggled with obesity all my life. I like myself as a plus size fat fitty. I like to own that word. I've always loved fitness, did a lot of sports. But now it's amazing. I feel like my exterior is starting to match how I feel on the inside when I work out. I feel fracking amazing every time.
Fracking.
Every time I have a workout. Although I will say, it's not I don't like wake up and be like, yes, I love it, because I do love it when I'm doing it. But let's be real,
Sure.
you can't just get up and be like unicorns and rainbows every morning.
Some people are like that, though. I wonder about their brain.
Get off your butt. Sometimes
You
some
know?
mornings I'm like, get off your ass.
I'm just like, I
You'll
don't
feel
believe
better.
you. I don't believe you. I'm telling you, I have
feel a
many,
lot
many.
better.
Whenever
can
they
have-
are like, oh yeah, jump
That-
out and into the gym, like, Fibber.
My roommate upstairs. My
Your
husband will tell
roommate
you that.
upstairs.
Yeah.
Yeah.
Yeah, he'll tell you. No, there are times and sometimes he'll be like, you haven't had a workout in 2 days. I need you to
Yeah.
be happier. So can you go?
I love it.
Oh my gosh.
Hey JT, who are you? What you doing? How are you? What's up? I know you
I
just flew
am-
in.
I love
But
that
tell me
shirt.
about who you are.
Thank you. Okay.
Oh, it's
so
cute. It's cute. Your shirt's
Thank
cute.
you.
Oh, that's
Look.
so cute.
It is cute.
That's cute.
Thank you. This is in honor. You know, I don't wear red much.
It's a
but-
shame. It's kind of your color. It's like, bam. You should
tell
wear it
her
more
that.
often.
Well, I
Why?
mean, thank you, but next month is Valentine's Day.
And it's Heart
And
Health Month.
It's American Heart Health Month.
That's right.
So,
See, I knew you would bring it home. You always
you
say
know,
the things.
so you know, in response to that, because every February
Mhm.
I get into February and I start scrambling for something red to wear that shows a heart. I was actually ahead of the game this year.
Oh,
Yeah,
good.
you are.
And I got
Look at
this.
you. I have a pink shirt. I have two. I'm gonna pretend like that makes me ahead because I didn't even think about it.
Yeah. Well,
Pink works,
Well, I mean, pink
Kinda.
always works,
right?
but
Always, clearly.
but I said I would wear red because heart health
'Cause
is
heart.
so important.
Yeah,
It is
now I'm
so
gonna have to get
important.
red. You made me think about it.
And especially with obesity and
Mhm, mhm.
you
Yeah,
know other
no doubt.
comorbidities,
Yeah.
That's right.
we have to be very vigilant about it.
We do.
So that in honor of those two heart
Round of
holidays.
applause. Round of applause.
Thank you. I'm wearing a red sweatshirt.
Cool.
love it.
I love it. All right.
Thank you.
So we'll get started. Enough with the shenanigans. Although many
I
of you
love
love
it.
the shenanigans, and those of you who are still here, you're the diehards.
Here for the shenanigans.
You're here for the
Diehards.
shenanigans.
Thank
Those are
you.
right. And we love you. All right,
Look,
moving
Thank
on.
you, diehards. Thank you.
We have a community guest tonight, and we have a doctor that is an obesity doctor, and we will talk more about how and why all of these things that many of us are experiencing are happening, because there's actually reasons in science and maths and all those things behind it. And so like we want to understand them, and we want you to understand them too. So today, our community guest is Jack.
What's up, Jack?
Hey, Jack.
What's
You're
up,
on mute,
Jack?
friend. You're on mute. You're on mute.
Hi guys, sorry.
Hi. Hey, listen, Jack, it just so happens that you have a cup that looks like mine. And this cup, if you purchase it and you use the code +10, it goes towards your favorite community podcast that is all done by donations.
I love the cup. It's my favorite cup. I use it every day.
I love it too. This is my family. I have like a, because you have families, This one's great though. It's a good family. Yeah. So you can
Yeah.
get yeah.
It
I-
is.
people be hurting people over these real Stanleys lately and stealing stuff. Like, relax, it's just a cup.
Protect
Why
yourself.
pay full
Protect your
price?
Stanley.
Crazy.
Well, because it's worth it. I mean, I think it's test of time. Like, I don't know if you've ever watched that movie, that show Yellowstone, but like he uses a Stanley and I'm like, they've been around since like, I don't know, forever, 60s
Yeah.
or something crazy. Yeah, probably longer than that.
Kim
Yes.
Kim is Jack, Cat. I think you already know this, but Kim is not the person to talk you out of buying a Stanley.
No, not at all.
She influenced me, and I said, Kim, this cup is really big,
Yeah.
and that's not Cat. But I said, Kim, this cup is huge. My arm hurts. You know what she told me? You'll get used to it.
And did you?
Yes.
And did you? And also,
Literally.
you're building, muscles while you're at it. You're like drinking your water.
I love it. Muscles.
I said the other day, people need to stop carrying Stanleys around and just carry Brita filters. It's not enough water. You need more. You need more.
That's about how heavy they are, isn't it?
Good point.
They are heavy though,
gosh.
especially the nice ones that are all MJ'd up.
Mhm.
I know.
That's what we're gonna call it from now on. MJ'd up. It's like cowboy up, but not.
I like this. I toggle between this one and
you,
our plus size water bottle.
I know.
Look,
I know.
guys
And
all
now
have
we're on
to-
12.5.
You all have the same one. I have the blue
Yeah.
one. I like this
Yes.
color.
I like it too.
I like that too.
But we were on 10.
We
when
both were all on 10 when it was.
Yeah.
Yeah.
And now Kat's on 15, Big Daddy.
Big Daddy.
Yeah.
She's on the
Big
upper
Daddy.
room. The
She's
upper
double
room.
what you're on, Jack. That's some crazy
But
stuff.
when people get like food aversion and all that, I don't have
Yeah.
that. I don't. I
No.
still.
Really?
I got my little plate of filet mignon right here.
See, Lydia just started to realize the food aversion on 15. She was like, "Is this what you've been talking about?" Like, yeah, boo, I've had this forever.
I mean, once in a while. I mean, like
Not in
sometimes-
bacon.
Stood on 10.
Like, yeah, you hit a wall fast. But you know what? I think it's I have a high thyroid, so I think that's part of it. My thyroid, I take medication to slow it down. I always thought that was really like the BS.
Mhm.
I told a doctor once, I was like, how is it that I have a high metabolism, but I'm obese? This is some bull crap. But
It is. You know what we'll do? We'll have to ask our special doctor guest.
Oh, very good question.
Oh,
Yep.
special doctor guest, if you're listening, we will be asking that question.
I believe that the special doctor guest knows all things.
I think so. I feel like that's probably true. Yeah.
Yeah. All things.
Anyway, something we do on our podcast is we offer you to take the space unfiltered and uncut and uninterrupted because Kat and I mute now.
Well, shut up. We shut up.
We mute now. So
Yeah,
that you
so
can
I'm
tell us
muting.
your story
We're on mute right
Okay.
now.
So you want me to start from the beginning?
from the beginning
Let
of
her rip.
Jack.
Okay.
Yeah.
So like
Let her rip.
1600 BC. I'm just kidding. So when I was born premature and I had RSV. I was really sickly as a baby. I had a lowered immune system, so I was in and out of the hospital constantly. So the first entire year of my life, because my parents only had vaulted ceilings everywhere else in the house, I had to stay in the closet. Foreshadowing. That's crazy, right? Because it was the only ceiling that had flat ceilings. And so I had to do that because I needed a dehumidifier to help with my lungs. So my entire childhood, I was really sick. I was on high doses of prednisone, on and off steroids constantly, which I think at a young age really had an effect on my eating habits, not only, but my metabolism as well. So growing up, I was obese. I always struggled with food. I always struggled with my eating habits. But I was always in sports. I did soccer, I did football, I did all the sports. So going into middle school, I had an issue where I went to eat, and I had always had issues with swallowing, but I went to go eat a piece of chicken, and a piece of chicken got stuck in my throat, and it was lodged. So we had to go to Scottish Rite in Atlanta, the Atlanta Children's Hospital, and well, actually, take a step back. My mom was like, it'll pass, it'll go through, like it's okay. So the entire night I was able to breathe, but I wasn't able to like drink anything. It would just come right back up. I wasn't able to swallow. It just was stuck there. It was like a lump in my throat. So went to Scottish Rite. They removed the chicken. They put me on fluids, but they had such a issue with trauma that day that they weren't able to get me in for surgery. So I had to wait till that following morning. So now I'm 2 days out from having a piece of chicken stuck in my throat, and all I've had is fluids. And my parents are eating Boston Market in front of me, and I'm so jealous. It's like the worst thing that you can eat in front of me. I love Boston Market. And so they removed the chicken, and they diagnosed me with eosinophilic esophagitis, which is an autoimmune condition that causes swelling in the esophagus. So that's just a part of my story. Going into high school, I was over 300 pounds, dealt with a lot of bullying, dealt with a lot of the typical stigma that comes with being obese and the hardships of being obese. And coming out and also being closeted as a coping mechanism, food becomes that thing that kind of fills that. I got tissues, guys. I had to get them.
I've got you. Okay. Everything's okay.
So
Okay.
it was
He'll come right back. There he is.
Come back, Jack.
Come
There
on
you go.
back.
sorry.
Hey, friend.
Okay.
All right, we'll shut up again.
So I got out of high school, and I really started to work out very seriously. I got with a personal trainer, and then she suggested that I do CrossFit. So I was doing CrossFit, and I kind of got like addicted to it, and it almost became like an unhealthy addiction because I was doing it twice a day. I was restricting my calories. I wasn't moderating. I was depriving my body. And so I lost a ton of weight. I'm about at the weight where I was when I lost all of my weight. So I was working out a lot, and I wasn't eating properly. I lost 140 pounds. I got to 200 pounds, about where I'm at right now. And over time, what I was doing just wasn't sustainable. I could tell the toll that it took on my body, and I slowly started to gain weight back. Getting into a relationship, and we enjoy cruising, and we indulge in good food, and it just, what I was doing wasn't sustainable, so I ended up gaining a large portion of the weight back. So I got back up to 255 pounds, and then that's when I went to go talk to my doctor. She ran blood panels and found that I was hyperlipidemic, and that I was in the pre-diabetic range. So from that conversation that I had with my doctor, she suggested that I try Contrave for the disordered eating, and that would work as step therapy towards getting a GLP-1 medication, because we knew that the medications were more expensive and that they weren't going to approve it without step therapy. So I did Contrave for about 3 weeks, and I got so sick and nauseous, and I was just really ill, and it made me feel so loopy. I was just not myself. I was really out of it. So after doing that, she fought for the appeal. They did it off label for Mounjaro, and with the autoimmune condition, eosinophilic esophagitis, hyperlipidemia and prediabetes, I was approved in like 4 hours. And so that was really awesome. I got very lucky because it was before Zepbound came to the market, because I probably would have had a lot more issues. But I got a 3-year prior authorization from my insurance, which was absolutely amazing. So I've been on since August, and I have lost 54 pounds. I'm 1 pound away from Wonderland. And so I am super excited about this journey. I just recently started sharing a lot more and trying to be more involved in the community, because this medication has really changed my relationship with food, but it's completely 180'd my health. And I just have like a whole new mindset. When you're constantly not thinking about the next meal, the anxiety that is taken off your back is absolutely freeing. And I just want other people to have access. So that's really what I want to aspire to help people get.
That's awesome, Jack. I love it. I will say, like, I love your lives. And like when you would come to my live, it's like the joy, because you were just the funniest. Oh, and the closet joke was so good.
That was fantastic, Jack.
That was poetry, baby. That was good stuff.
Yeah, I was like, how didn't you know, Mom? You put me in there.
It was really hard not to bust out laughing, but I kept it in.
Yeah.
I stayed on mute. I
was on mute. That was great.
Yeah. This is why Kat and I have to stay on mute, because we will be like, oh, really? Oh my gosh.
And
we'll do that.
Yeah.
You'll be here like spilling your guts, and we'll be like, oh my God, because we're bad.
And I understand, Jack, because that Boston Market cornbread.
Oh, no, I'm here for the mashed potatoes and gravy. Premature, and how many people came in your live that were preemies, and I'm like, the algorithm knows.
Wow.
Oh my gosh.
Tons of people
Also,
came in that were premature.
I told this story on my live a few times about when I first found the community, and the first person that I found was JT, and I didn't know anything about GLP-1 medications, but she was talking about it, and I was in her live for like 3 hours, and then I just wanted to like find more content. So I went to the search bar and I typed GLP, and then I typed Mounjaro. I spelled it Monjiro, because I didn't even know how to spell it. But I just wanted more. I just wanted more content. I wanted to find it. So I just thought that was like a nice little tidbit.
That is nice.
Awesome.
I know. Obesity in childhood. So I just thought between you and me and Kat, like we may want to touch on that a little bit more. You know?
Of course. Yeah.
Okay.
Thank you.
Let's invite her in. Hi, Dr. Lofton. How you doing?
There she is.
Hi, everybody. How are you doing?
Oh, hey.
Hi, Dr. Lofton.
Hi. I was listening backstage. We have more things in common than I knew.
Yeah.
Oh.
Yeah. Before we get to the questions, let me rattle some of those off. So one, I'm from Atlanta.
Oh,
yes.
I didn't know that.
Atlanta. Yeah. Childhood obesity.
Mm-hmm.
My dentist actually was next to Scottish Rite Hospital. So
oh my gosh.
Oh, wow.
Wow.
So this is the thing about Boston Market. I went to school in Boston, and they had lots of Boston markets, and I'm vegetarian. My favorite thing was the mac and cheese, but I had to stop eating it because it contains lard. That's why everything is so good.
Oh yeah, because
Wow.
Yeah.
It's not, their vegetables are not vegetarian unless they change that. That was a while ago, but
yeah, maybe. I doubt it.
Oh yeah.
It tastes the same.
Tallow in there. Wow.
Oh no.
That's how, like, I think that's what they are.
What about the apples? Is there lard in the apples? Because those are good. The cinnamon apples.
I didn't look at the ingredients. I was looking to see, why are these so good? Why is this so good? And it said lard.
Because lard. Because lard.
Yeah.
So there's two things that make things delicious: lard and gluten. You put them together. That makes sense. That makes sense. Well, we're so glad to have you. If you could tell our audience a little bit about who you are and how you help people, we'd love that.
All right. So I won't go back to 1600 BC. We'll start like somewhere in the 80s. So I grew up with childhood obesity. Long story short, I went to some community-based program meetings that shall remain nameless with my mom in the summertime between 6th and 7th grade. And I utilized those recommendations to really lose a significant amount of weight. And I felt the impact of that socially when I went back to school, 7th grade. I felt like I was treated as if old Holly had died, a new person was born, and I sort of vowed to try to, one, keep this weight off for the rest of my life, and two, help other people feel this way. So that is why I'm a board certified obesity medicine specialist.
Yeah.
And I did fellowship in nutrition and obesity medicine. I also see patients for weight gain. So just so you know, I can see anyone. I see weight loss, weight maintenance, and weight gain. So anyone can come to me. And I've been doing this for about 15 years. I practice at the NYU Langone Weight Management Center in Manhattan. And I love what I do.
Awesome.
Amazing.
Can you guys still hear me? I feel like I lost my audio.
We can
Remember?
definitely
We can hear you.
Great, lovely.
You feel great.
Good
You
news.
sound great.
Thanks. Good. I'm glad we fixed it. Anyway, hey, Kat, let me give a question.
We got the question. Oh yeah, let's do it. So obesity treatment's being seen more and more as holistic, like the whole person. Fitness, mental health, and nutrition. How significant is depression in treating and preventing obesity?
Well, I'll start with answering that question by broadening it a little bit and just say mental health issues overall, because there is a spectrum. So there's what we call dysthymia, where you just have kind of a general lowering of your mood. And we all go through this sometimes. Something happens, we get a little depressed for a short time, and then time goes on and gets better. Depression itself, it's a clinical condition that can be inherent, can be genetic, can be also environmental, but generally lasts longer than dysthymia. But we also have other mental health issues such as bipolar, anxiety, and these things can really be mixed. So I really believe that stress management, as well as managing mental health conditions, is very important when assessing someone's need for obesity management, because if we don't have control over mood and also internalize not only the weight bias that we experience from the outside, we can get, that can cause us to have, as we mentioned earlier, Jack, eating our emotions, seeing futility in even treating the weight condition. So I screen all my patients for mood disorders, especially at initiation, but every time we come in, because if we're not getting the management of mood and stress, we're really going to have a limit on how much we can do from a weight management perspective long term.
Right.
Yeah. I was curious about, so, we talked about the mental health piece is something for sure I struggled with. I was diagnosed with bipolar, but I was actually, I think maybe not. I don't think that's actually, honestly, now, so many years later, 20 something years later, I think that's what I had. I think I've just always had obesity, and I think it contributed to a lot of things. And I had also been assaulted in college, and it was right after that. I think it was just trauma and stuff like that. So I think it's easy to be kind of misdiagnosed. But it's, I think that's also like a diagnosis that I think that we maybe don't screen for enough or like thoroughly enough. Like it was, I got that diagnosis like that. Like I walked out of that office that day, first day with that diagnosis. But I definitely always struggled with anxiety. And I can't even, like, honestly, the fact that I'm here and like on a podcast and all the things, like, it's kind of crazy because, but since this medicine, that obsessive, like constant worry and thoughts, that turned off like a switch for me. And, it wasn't any other medications. And trust me, because the bipolar diagnosis, I've been on tons of them, like tons of them. And honestly, the one that made me gain so much weight was Depakote. And that was before they had approved Lamictal. And Lamictal, I wish they had let me take it off label, because maybe I wouldn't have gained all this weight, But I've talked about it a lot on the show, but it just seemed kind of relevant to the point. But I think that like the mental health piece is so important. And it's not like I think this is the end all be all, but I do think that the medicine has put me in a place, if it makes sense, to be able to receive therapy and, if you will, cognitive behavioral type of, I don't know, suggestions. I'm not sure if that's the right way to put it, but I've like just things I've been able to do with my relationship with food. Like, do I really want that? No, I really don't. Stuff like that. I've never been able to gear shift like that before. I don't know what it is. And I have yet to find anybody that really has a clue. And then maybe there's not anything that's concrete about it, but I can't help but wonder, like, do you know? Like, do you know what it is that so many people have had improved mental health when they take these medications outside of just losing weight and feeling better, which often happens, right?
Yes, losing weight, feeling better, getting compliments, your self-reassurance, new clothes, all these things people really like. But there is some evidence that really came to light when they started to investigate what happens in animal models. This is not in humans. They didn't chop up the human brains, but they did animal models. Sorry,
Right.
mice. And
Sorry,
they
mice.
looked at what happens to dopamine levels in the brain when you're taking GLP-1s. And one, the response to previously enjoyed foods. I'll say comfort foods. We
Right.
also call them hyper palatable foods, your favorite food, and that differs for everyone. The dopamine response is dulled. So there's less. So the favorite food is just not as exciting anymore, or one bite's enough and the rest don't really matter. So that can really happen. And it's thought that that shift in response to hyperpalatable foods or comfort foods somehow affects dopamine so that we just feel better, and that can make someone more responsive to the therapy. And I have seen a trauma psychologist come to me and state that one of her patients on Mounjaro was able to open up in one session and receive the therapy in a way that it previously was taking that patient a year to really make changes in that one session. So I think we'll learn more about that to come, but there's likely, we have these GLP-1 receptors in the brain, and the brain is very complex. So that's part of the
Indeed.
reason why.
That's
Yeah.
awesome. Thank you so much. I appreciate that.
It made me also think about
Go ahead.
can I jump in? ADHD. A lot of adults that are undiagnosed or they find out they have ADHD later on in life. I guess how does that differentiate when you talk about mental health and coming in with the testing with your patients, initiating that? I guess what would be the fine line between ADHD and binge eating versus the Mounjaro or the GLP-1 that also helps? Do they do sometimes those medications, like if you take a ADHD?
Oh, you mean like with Vyvanse? Is that what you mean?
Yeah, or
because that's
Adderall?
FDA approved for I think BED.
Yeah.
Yeah.
Or do you see it? Do you see the ADHD medication having like going by the wayside and just using the Mounjaro, or do we use both in concert, or just therapy for ADHD and Mounjaro? Does that make sense?
It does. So
Okay.
a couple of points here. So it is possible to take medications that are stimulants for ADHD and still have a weight problem. So it's not like these meds they're not speed. I want to put that out there. You're like, these are speed. They are not. They work in a way where they stimulate your norepinephrine and your serotonin to a degree, similar to how a phentermine would, but it's a different mechanism, the way it affects the brain. It's sort of counterintuitive. You're like, how is something that's a stimulant going to calm me down from overthinking things? That I never really fully understood, I'll tell you, but it works. But I find that with ADHD, man, let's say we're using Adderall or Vyvanse, sometimes it creates this pattern where the drug has to wear off so you'd be able to go to sleep at night. So what happens is patients sometimes aren't hungry all day because they're repped up by their Adderall, their Vyvanse, and then it wears off so you can go to bed, and then you have a lot of hunger. So I see this pattern where people are not eating, and then eating, and that actually can cause weight gain. It's not the medication itself causes weight gain, but the pattern of eating majority of calories in the evening creates this night eating syndrome, which makes people gain weight. So that can happen with ADHD medications. And I think now this idea of food noise is really popular. I always try to determine which patients have binge eating disorder versus patients who are thinking about food a lot or maybe overeating. Overeating versus binge eating disorder is very different. So I ask my patients, do you feel like there's a static? Like a TV is on, it's static, and it's just saying food. And people who have binge eating disorder they would say, yes. Yes, how'd you know? That's exactly what I'm experiencing. So those are my patients I'm going to go more for a Vyvanse, because that's coming from a different area of the brain than the appetite center, which says you're hungry or you're not. There's that static going on. So that's why, I really try to define the binge eating disorder. And of course, there's all these DSM criteria, but to really put it into lay terms, that's how I define it.
That's fascinating. Kat and I both struggle with binge eating since we were young and into adulthood, and have both been able to, actually
Yeah.
have that be treated with these medications in a
Yeah.
way that never before.
That
Um,
static analogy is
that
fantastic.
static one. Yeah, that's so true. It's like and it was almost like I couldn't stop. I don't know how to describe it. Like, it wasn't like, I mean, for sure, like when, you overeat sometimes during stress and stuff like that. It's not like that. It's constant. It's all the time. It's
Mhm.
going to bed thinking about food. It's everything that you're doing. Food's just like right in the back of your mind. And you could be in the middle of eating one meal and be thinking about, what you're going to eat the next meal or at dinner time or the next 5 meals. Like, it
Mhm.
was constant. And being free of that has left a tremendous amount of capacity for my brain to do so many
Mhm.
other things.
Good.
And that has just been life-changing for sure.
Mm.
Something that Kat, had asked about or had put some questions in, is that she and I both are larger humans. Like, we're tall, larger people. And, and we're sort of at this place, she and I, oddly at the same time, where we're the smallest us we've ever been.
Mhm.
Like, honestly, there are some people who gain weight, and they it's because but there used to be a thin them, right? There is no thin me in the history of me. Like, it
Mhm.
does not exist. There is no thin Kim, right? So the mental piece of trying to reconcile with that I'm the size I was in high school and I'm still plus size. Like, I'm still, in the 240s. I'm very tall, but I'm still plus size. And I'm scared to not be plus size because I've always been, and I've become to where I've almost identified with that. So
Mhm.
I think that has a lot to do, in my opinion, and kind of what I've been working through with the body positivity movement, right? Like, with people saying this is who we are and accepting our bodies for who they are and what they are. But part of me thinks the reason that I did that is because I had to survive, right? With
Yeah.
the way that so many people with obesity are shamed and just treated horribly, especially in this country, you know? And I'm curious, like, in treating people with obesity, especially when they get down to where that switch is about to happen, right?
Mhm.
And maybe they've never been thin, right? How do you handle that? Because I mean, Kat and I don't know what to do.
Well,
Therapy is good, but still.
well, one thing that I see very commonly in treating people who are losing a lot of weight is that the self perception of your own may not change, even though what's in the mirror will change. So someone can lose 100 pounds, but they still see themselves as 100 pounds heavier, even though I'll show them your weight graph. It's gone down 100 pounds. They say, no, I'm not. It's still the same. You don't see yourself as that thinner person because that's how you perceive. So the outside world looking at a thinner Kim, where you're still seeing a heavier Kim. And then we have to learn to accept that both are okay. And you have to feel comfortable in the body that you're in. Another example of that is people tell me they'll lose weight and they'll still go to the section of the store where they're the clothes are bigger and the saleswoman's looking at them like, what are you doing in this section? You belong over here. And they're like, no, this is my size. And they won't get new clothes and things like that. So being comfortable with how you look, and also learning to decide if you want to accept compliments. Because if someone says, oh, you look so great, what someone hears is, I didn't look great all those other times that you saw me. And that can bring upon some situations where people start to regain weight because of the fear of
Mm.
compliments, the fear of being noticed, sometimes by suitors. If you've been traumatized, you don't want people to look at you because you might be traumatized again by them. So these are very much things that we deal with therapy, because the self-perception and the outer perception are totally different.
That makes a lot of sense. It makes me think of because I've gained and lost many times in my life, and I do recall there was a point when I did get fairly low, but 20 years ago,
Mhm.
and I realized how comfortable or just accustomed I was to being invisible.
Mhm.
And then all the extra attention started to first it was an inconvenience, and second it made me uncomfortable. Like, this is way too much. Like, I'm used to being invisible, ignored. This is whoa. Yeah, yeah.
Yeah.
It's an
Mhm.
adjustment.
It is
Then I gained it
bizarre.
back.
Yeah, well, I mean, I think that happens a lot, right? I don't know.
Mhm.
I think that our brain, I don't know, it's like constantly fooling us. I don't know how to describe it. And I'm sort of recognizing that it's trying to fool me right now, if that makes sense. When before, I don't think I did, right? I was like, okay, let's go eat some more, things like that. And like, I'm gonna go take some liberties. I'm gonna have 10 wings and I don't know, like whatever, right? And and then but I'm realizing like when it starts to kind of like get away with me and being like, wait a minute, is that what's actually going on? Like the ability to slow your mind down and really understand the behavior, I think has been a very powerful experience for me.
Mhm.
I really wasn't capable before. I really wasn't, and it's just so nice to be capable, you know?
True.
Yeah.
Yes, indeed. All right. So we got another question for you too, as we have all of them for you. So you shared with us on the beginning and in your bios that you struggled with weight during your preteen years, and I read that you assisted some of your classmates as well. What is your outlook on varying levels of obesity, genetics, and the treatments of, or are there, would, in your opinion, be varying levels of like ways to treat obesity?
So this is a really packed question. One thing I do draw for my patients when they come in is these 3 circles.
Yeah.
And the circles are, what controls your weight? It's more complex than this, but I have the genetic circle,
Okay.
the environmental circle, and the physiologic circle. And they're intertwined in a Venn diagram. So,
Okay.
and then tell them your genes control 40 to 70% of your weight.
Wow.
And there's nothing we can do about it right now. There's no gene treatments that we have that can fix that part. And that's why even with the best medication, the best lifestyle, you may not get to a thin person size because there's just that aspect. And of course, genes affect physiology. Then when we look into the intersection between genes and environment, a really common message I get is I ask people when they start to gain weight and, being in New York, they say, oh, when I moved to the US from what other country. So what happens there is epigenetics, meaning there is a gene that was turned off when you were living in your home country. But you came here and were exposed to something. Maybe it's the air, a food additive, something that turned that gene on. So previously you could not keep weight on in your other country. How come you can do it
Yeah.
too efficiently here and
Totally.
really start to gain weight? So the epigenetics, the combination of how environment affects genes is a piece, again, that we can't control.
Right.
And that's why we need the treatment. So the only things we can affect are our environment, diet, exercise, behaviors, and physiology. That's medication to help your body want to lose weight. Our bodies are designed to survive famines. So when we eat less and move more, the body says, oh no, I don't want her to die in this famine. So let me slow metabolism, let me make hunger hormones go up, let me make fullness hormones go down. And the treatments we have now do the opposite of that. And there are more treatments in the pipeline that will do that more effectively and treat more people and be tolerated by and really accepted physiologically by more people so we can find these. And I think that's what's really unique about, this newer class of medication, because if we were talking 20 years ago, we say, if Intramine doesn't work for you, something must be wrong with you.
Right.
You're lying.
True.
And what have we discovered? I really think that people have a GLP-1 deficiency.
Yeah.
And that's something that we should consider renaming obesity as we look into other
I love that.
aspects. Because what do? We have low thyroid. We give you thyroid hormone back, and then things get better. So we give GLP, we give GIP. There's a third G, the glucagon one. When we find the right G's for the person, we're getting results like we've never seen. So that's how we can adjust physiology independent of the genes that we were born with.
Love it.
That's
Brilliant. Love it. Hey, Jack. I have a question for you to ask Dr. Lofton. If you look at the chat,
Oh, sorry.
you can read it. No, it's okay. I just think it's a good one.
Oh, I had a question.
I can cut out all this weirdness. It's fine. Lydia,
I
cut
can
the weirdness out.
read that as well, but I kind of had a question very similar to that. So I'm glad.
Do both. Yeah, do whatever you want. It's fine.
Building on the topic of childhood obesity and some GLP-1 therapies approved for ages 12 and up, what are your thoughts on the subject? What are some of the instances in your professional opinion that would be suitable for children 12 and up?
So the question is treating adolescent obesity with GLP-1 therapies. I think it's long overdue. I don't think that we should reserve medications for adults if they're proven to be safe in teens and adolescents, which the studies have shown most of the medications that are available for anti-obesity to be safe and effective for age 12 and up. So those have been studied, I think should be available. I don't think we should wait until someone is 18, and 2, bariatric surgery has bariatric surgery potential to treat. Because what is that person going through in those 18 years that could potentially be irreversible with regards to mental health, liver disease, diabetes? Why should we delay that? So these treatments, I think, should be, of course, used in conjunction with diet and exercise and behaviors, but we need to treat early because our teens and our adolescents are getting these diseases that can be detrimental. And if we don't treat them early, they may not make it till 40.
Yeah.
Wow.
So
yeah.
I do think that, in instances in which I think it's necessary, you've tried what you can from a basis, like you said, doing all the sports. I did 3 sports all the time too when I was young, still had the weight issue.
Same.
You've done the support groups and all these other things, and you're getting sicker as a child. Not only physiologically with glucose issues and liver issues, blood pressure, cholesterol, but mental health, social isolation. Those are situations we should be more aggressive than diet and exercise in younger people.
Yeah. Yeah. I there is a tremendous amount of just like shame and stuff that went on with me. Like I even though like I'm not like Kat where I was like Queen Fitness, but I was in Flagline. You dance with a flag on a football field. Like I was also a singer, so I was like, it wasn't like I wasn't social and I wasn't active, you know. There she is. We got JT Beck. But I also played softball. I did ballet and tap. Like I was always very active, but I was still big. And everybody just said that it was because of how badly I ate. But the thing is I didn't eat badly. I don't like giving like that to food anymore, but like that is what I thought at the time. But I didn't eat badly that much in front of people. It was only when they weren't looking. Right. So, and then I think that's where sort of like hiding the food because I felt like I couldn't stop. Right. Started happening. And I remember when we first started this podcast, like episode 5, we had an obesity doctor on. And I didn't even want to touch the whole childhood obesity thing, even though I had struggled with it. I just didn't even want to go there. And eventually we decided if we could ask him the question because the community was really like, we want to know, right? Because if it wasn't about them, they were thinking more about their children and grandchildren. What does this mean now that we know more? How do we get ahead of this, or can we? And, I asked him about it, and he was like, there's, he specifically mentioned that there was a disorder called Prader-Willi's, I think, where children, he's like, this would actually be a really good treatment for someone like that because the only treatment is putting a lock on the refrigerator. And he was talking with us about that, and we were like, oh my God. And we didn't even know that was a thing. And we also didn't know that that there were bariatric surgery that could be done on children. And he said to us, and it was like a big moment, and he's not a specialist for children. He said, I think that before we consider doing a life-changing, life-altering, body-altering surgery on a child, we can consider a medication. Like we should at least talk about it. Just because it's, something that you shoot into your skin, I don't think that it shouldn't be part of the conversation. And I thought that was fascinating. I had never heard that before. I'm glad to know that you're like open to it. I'm wondering, like, when we did have a childhood obesity episode 2 as well. And we're hearing that it's even harder for kids to get approved for the medication than it even is for adults, though. So they would much rather approve the surgery.
It is. The insurances are thinking about a lifetime of therapy, and unfortunately, that's financially driven when it should be health driven. To point out, though, Prader-Willi and other genetic syndromes of obesity, we call these. These are usually identified in the pediatrician's office because there is it's highly abnormal rate of weight gain in a young child. So we're talking 2 years old, 18 months, you see obesity. And we do screen for that in our adult clinic, but we see it usually is diagnosed in the pediatrician's office because the weight curve is they're off the chart before they reach 2 years old. We actually screen with genetic tests for syndromes like Prader-Willi, Bardet-Biedl syndrome is another one, because these are defects in the receptors for satiety in the brain. And if they really have both genes for those deficiencies, such as POMC, which is satiety signal, the leptin receptor, then these drugs actually won't work if they have both genes. There's one drug that does work called setmelanotide for these people with Bardet-Biedl and Prader-Willi. Bariatric surgery does not work with Prader-Willi. It does not. So that's something we see someone fail bariatric surgery and say, let's do this genetic test, because there is one drug now that if we can prove the patient has these genes, there's the company actually really helps get approval, because it's $25,000 a month.
Oh my
Because
gosh.
it's the only thing that will treat it. This medication is setmelanotide. So we do have treatments for those. And they are approved for, I think, ages 2 and up.
Oh my gosh. 25,000 a month.
It gets covered though.
It does, because
yes. And there are a lot of clinical trials going on with them, because it's so rare. I mean, this is 1 in 5 million really people have these. Yes.
Wow. Fascinating. Wow. Sorry, that like blew my mind, girl. JT, can you see us? Because we can't see you. I keep losing you.
I can go ahead.
I can hear you. Wait, no, that was Kat.
That's me.
Okay, we can't see or hear her. JT has left the building. She has found the exits.
Dr. Lofton, speaking to childhood obesity and the coping mechanisms that come along with obesity, I, for one, was someone that coped with eating, and also with humor was a big coping mechanism for me. And from a young age, I ingrained it in myself that the way to make other people like me was to degrade myself, and to degrade my looks, and to talk poorly about myself. So what are some things that you think that could help children dealing with obesity, but also the mindset struggle?
And it's a really important topic, because as you mentioned, I have this with one of the physician assistants who works in my practice. He actually wrote a book on this before I even hired him, called Lose Weight, Find Yourself. And he grew up in denial about his sexuality, and masked this with overeating and some social isolation. And then when he was ready to come out, he was able to have great success with weight loss, and also made this his job. He works with me, so he does that. He works out a lot and things like that. And then wrote this book to get the message through. The therapy aspect of that is just immeasurable, and how much it can be helpful, because dealing with trauma from childhood in many different ways, whether it's related to the weight condition or not, because it can always come back. You know, we don't say that obesity is cured, it's in remission. So I consider my childhood obesity to be in remission, and we know that this can always come back. So you have to stay on top of that. So dealing with coping strategies and continuing the therapy, and it could be at different levels. Sometimes you'll see a therapist, sometimes you'll read self-help books, sometimes you'll do that with working out, but really getting to know what your triggers might be, and then refocusing those from eating. But I also hear that thing you're saying, Jack, where some people make fun of themselves before someone else has a chance to.
Yes.
And that behavior then just breeds more internalized weight bias. Like, they must be right. I am like that, and I should make fun of myself first before that before the group has a chance to. And that is something that we see as in the medical field as well, this internalized weight bias. You know, back in the day when, and this could still happen, some doctors say, if you were just trying harder, you'll be able to lose this weight. And these are the negative stereotypes that we have about you. People really take that on, and then have these poor coping mechanisms, which can limit results.
Yeah, for sure. That therapy piece has been a really big thing for me. I think, and I also think that community is a big deal. So a lot of us that have found a community on TikTok, of all places, jeez. I swear, if like 20-year-old me would like hear this, they'd be like, what the heck is wrong with you? Get off the internet, you know? But it's true though, like being able to process like so much of this and have people that know what you're going through,
Mhm.
right? And it's been incredibly healing to have that connected piece. I feel like that's, I mean, of course the medication is key, right? But the difference this time, I think, of having it stick. And even when I have moments like I've had recently where I'm like, I'm not sure I want to lose any more weight, even though technically I'm still obese, right? And it's because of this. And I just posted a moment feeling very vulnerable, sharing it with my community of 47,000 people and thinking that it would like, this is ridiculous. And when I did, the amount of people that were like, me too, it was huge. And I felt like, oh, okay, so we've got this, we can do this, you know, and it's okay.
Right.
And hearing that from others, having that community piece baked in, I feel like has been such a big difference for me. Has it been for you ladies too?
The community is definitely
Yeah.
a major impact. I do want to say, like, you know, through body positivity, all these many years, like I've learned to embrace and enjoy how I look. So now I am at that crossroads where like
Yeah.
I like this. I like this. If I could lose more, I would like that too. But I'm enjoying this, if that makes
Yeah, it
makes
does.
sense. But yeah, I totally get that. Yeah.
Minus the skin. I'm ready to get rid of that. But, you know, minus that, I think, you know, I'm okay with it. You know, I also don't even feel like I have to run and go have surgery or anything like that. I think eventually the skin is going to continue to be an issue. It's a lot,
Yeah.
you know, 100 pounds is a lot of weight. I've never lost this much before, you know?
Amazing.
So, yeah, I mean, it's crazy. And I don't know, like I hit these things, and I'm curious, maybe you can kind of speak to it a little bit about set weights. Like we've heard about the set weight theory, and I feel like I've hit many on this journey. I have so many friends that they lost consistently 1 to 2 pounds a week, 1 to 2 pounds a week the whole time. And every now and then they'd be like, oh, I gained a little bit. Man, they were just like this. I'm not like that. That is not how I roll. Like my body is like this and like this all the way around. So I never did like cute shot day videos or anything like that because I had never had anything consistent. You know what I mean?
Yeah.
You know, and but I'm wondering, like, I remember when I hit the weight that I was before, like when I got pregnant with my son, miracle baby, pregnant with my son, and I remember it was 280, and my body fought that weight and made me gain and go back down and bounce around for 3 months until eventually it let it go, you know? And it's like I don't really know what that is. Can you explain like what the whole idea of set weight theory is?
Yeah, so this is a theory, I will say.
Yeah.
So it's not been proven that there's a set point. But what you're referring to is, you know, in equilibrium, if we kind of just let everything go, this is the weight you're going to be.
Yeah.
And we think certain things can treat that. Surgery treat that? Does it really change it? Does medication treat that? Does it really change it?
Yeah.
But one thing you're commenting on is the trajectory of weight loss. So
Yeah.
I actually weigh, you know, first of all, I'll just say in my practice, the number on the scale really doesn't matter to me. The goal is health and happiness. So once you have normal labs, feel good, and then we'll work on maintenance. That's what I tell people.
Okay.
But we look and see, okay, what's your graph look like? Does it look like this? Does it look like this? Or does it look like you said this? That tells me what your body is doing. When you start getting to this part, you're trying to eat less and move more, your body's fighting back. You're trying to eat less and move more, your body's fighting back. So that tells me that if you want to get below this, we need to change something because your body is saying, I'm not doing it.
Yeah.
That was my whole 2023. That's awesome. Okay, but it's starting to like move down now. But yeah. Oh wow.
Eventually.
So you know, you look at the trajectory. That's why I like graphing the weight to see what's going to happen. Is how proactive I need to be. And if we need to get down here and we're here, we probably need to change your medication or make a major dietary change or see if there's something else we can do in the environment. Because when you look at the graphs from the studies, they're all like, phew, but those are an average of 2,000 to 3,000 people. Keep in mind.
Yeah.
That's why it looks like that. A lot of times I see stair steps down with weight.
Yeah.
So it's really about kind of evaluating where you are in the grand scheme of things.
I definitely don't even consider like looking at my rate of loss, and I still have a cycle. So I don't even do that until the month is over. And then when I look back, it's about 1 to 1.5 pounds a week.
Mm.
But if I look just by week, sometimes I'll be up 3 pounds and I'm like, I think that's poop and water. You know what I mean? Like,
Exactly.
you know, that's why I just like, you know, but I had to learn a lot about that. It has been interesting to have a better relationship with the scale, if that makes sense. Through this whole process, it is a like JT says, it is a marathon, not a sprint. Like it is a time thing. It is a commitment. And like, I mean, there are some people that we know, like we have somebody in our community and I think he's weighs over 400 pounds, but he's lost like so much weight. I want to say like 60 pounds or something like that in just like a few months, you know? So it's like everybody seems to have a different kind of rate of loss, you know? Yeah. JT, I think you had a question.
Yeah.
Now that we can see you, your lovely face.
I'm so happy to see you all. But Dr. Lofton, in your practice, how do you evaluate success in the treatment of obesity? Meaning, do you evaluate all wins, such as blood work, quality of life, and movement on top of the number on the scale?
That's a good
So,
point.
so the first thing I ask people when they come in is, you know, so my door says weight management. So I know why people are here, right? But I ask them, why are you interested in weight management? What do you really want to get out of it?
Mm-hmm.
And that first statement is what I'm evaluating as, did we achieve that? Because we know that our scale goals change, right? I see people, I want to lose 30 pounds. We get to 30 pounds. Oh, the goal, that number changes. It's okay. Now I want to lose 40 kg. That's fine. So I look at your health and your happiness, normal labs, you feeling good, being able to move throughout the world with ease. So if previously your knees hurt and now they don't, that's a non-scale win. And also, you know, confidence, mental health, those are things that really can waver, even weight is up or down due to other things. So we really look at all of those, not just the number on the scale. We have to put the number in the chart for insurance purposes.
Sure.
Otherwise, I wouldn't really care. But I like to graph it and things like that. But it's really about you feeling good. You know, some people say, I want to be able to tie my shoes. And I can't.
Right.
Okay, let's achieve that.
Right.
Yeah.
Totally. Yeah. And I think like having those smaller goals in the beginning, even if it's just to tie your shoes, like it's huge. I mean, I think like I remember I went to the beach this summer with my son, and for the first time ever we swam in the ocean, and like I was just jumping the waves and riding the waves, and I could do it and my knees weren't buckling underneath me and I wasn't in pain, and I was just enjoying the moment and just the beautiful like richness of that. And it was like I was like, everything is worth it just for this. Like it was the coolest thing. You know, I think it's just that people don't realize there are people that want to be thin and skinny and all of those things. I think the only reason we want that is because of society, which will go into JT's question. But I feel like we just want to see our children grow up. We just want to see our grandchildren. We just want to be able to have adventures and not be in pain, you know? And I'm always like just saying, I feel like, you know, people with obesity, we're just people that have a sickness and we need medicine and we deserve medicine. You know, I think that going back into like how society views it and continues to look at it like it's phentermine or like it's a diet pill. I don't know how to get away from that. I really don't, you know?
Yeah.
It's awful. Go ahead, JT. Sorry.
Yeah. No, that's actually a really good point, because so many people who are entering the community are like, oh, the, appetite suppression. And it's like, that's all they focus on. And I always say these medications do more than just appetite suppression. If that's what you wanted, you could go to the drugstore and get it. But, thank you. But we seem to be in a time where obesity medicine is becoming more prevalent in the public eye. So do you predict a time where the greater public and medicine will be able to see obesity differently than just caloric deficit?
I think we're getting there to look at it from a more holistic approach. And I think that's starting with combining the body positivity movement with the fact that we have safe, effective treatments. And one, knowing that those two are not in opposition. You can love your body and still want to lose weight. And I don't think we need to pick one And if you're in a body positivity group, don't shame the person who wants to treat their weight, with medications or whatever treatment they decide to do so, because that's their body and it's about how they feel. So I think with changing opinions, recognizing weight bias, I do a lot of talk about weight bias because that's still one of the discriminatory practices that's unfortunately still accepted in the media, in schools, in workplaces, in the medical setting. We need to understand this exists and it's not okay. We need to change that bias. It should be completely unacceptable, like racial bias or things like that. And then we can't be in a place where we're shaming people for being a higher weight and we're shaming them for treating it. I had to tell this to a patient the other day. She said, I really don't want meds. I said, well, what's your reason for not wanting meds? She said, well, I don't want people to think that I'm taking meds. So I said, well, you don't have to tell anybody outside this room, but you're going to have opposition, unfortunately, in our world either way.
Yeah.
If you do or if you don't. So really changing that narrative. And I don't think we should hide it. I don't think we should feel that it needs to be something that's under the table. Of course, it's your body. You can just decide what to disclose. I give you a lot of credit for Mounjaro cups, by the way, with the group. Love it.
Yeah.
Because it shouldn't be anything shameful. We don't shame people for having cholesterol issues or diabetes issues. Again, those are culminations of genes and behaviors and physiology too. Yeah. So it's really about changing the perspective, and we're getting there, but there's still a lot of work.
Yeah, for sure. Yeah, we're trying to.
I like that. We're on the same road together. We can just, put it together.
Yeah, like they don't have to be mutually exclusive. You can be positive about your body while you're treating your disease.
I feel that way. Yeah.
Yeah. Yeah. In terms of insulin resistance, we've been hearing this a lot on the show from doctors kind of talking about this being a spectrum, right? But does everybody that has obesity have insulin resistance of some sort?
We don't know is the answer, because we can't measure insulin resistance very well. There's a time.
How do we measure it? Can you explain it, the ways that we do?
In research settings, there is a test called a HOMA-IR. It's a test for insulin resistance, but it's really expensive and not really feasible to do just when you go to get your labs drawn. So they don't do it all the time. But I believe that insulin resistance is present before it shows up on labs. So I don't think we have a sensitive enough test to determine everyone who's insulin resistant. By the time we see it on labs, we see insulin levels rising or we see A1Cs rising. The insulin resistance has been present for decades, maybe.
Right.
So I think we need a better screening tool to determine who has insulin resistance and who doesn't. Now, but we do know sort of the other way. So if you have type 2 diabetes, we know you have insulin resistance. If you have non-alcoholic fatty liver disease, we know you have insulin resistance. So we can see that backwards. But I think we need a better screening tool to see who's insulin resistant so we can treat early. Yeah. The other thing is a lot of the meds that cause weight gain, you mentioned earlier, medication-induced weight gain, steroids, some of the antidepressants, those cause an insulin resistance. Yeah. But you don't see the numbers changing until it's too late. I mean, how long have you been on? What was the one you mentioned? You were taking
Depakote. Yeah.
Labs were normal for a while. Then one day they switched. So there was a period in which we didn't know you're insulin resistant.
20 years. 20 years for me. Exactly. Yeah. More than that even, because I think it was before I even met my husband. So I mean, and it wasn't until honestly, it wasn't until COVID, till I hurt my back, till I gained the weight back again. I couldn't get it off after I had my kid. And then I go to the doctor and they're like, hey, we got to talk, like next time you come, we're going to be having a different conversation. Let's try to do something now, So yeah, I think it's interesting. Yeah. We've just been hearing a lot about that, from the doctors, but when you go to the doctor and you're trying to have a conversation, let's say if you can't get an obesity specialist, we know how hard that is. And we know about Fridays, like Jack and I both know Fridays very well. And we love that allows people to have access to obesity care, right? And a protocol, have them treated that way. But not everybody can do that for whatever reason, right? Whether it's financial, maybe they're just not ready, like lots of different reasons. So if they have to go to their general doctor because they need to use insurance for whatever reason, how can they go and ensure that they're going to have the time to have this conversation? And can you suggest maybe some things that they could ask for? Like, could you test me for this, right? Could you run a test to check me for insulin resistance? Could you test me for, should you pull a non-fasting insulin? I don't know, or something like that. Is there anything that we can do to try to help, because there are so many, general doctors, I just want like PCPs, however it is, that they just don't know. They really don't. And it's gotten to the point where as the patients, we're kind of having to advocate for ourselves.
Mhm.
Do you have any suggestions?
Yeah, so I'm involved in a group. You may have heard of the Obesity Action Coalition.
Yes.
It's obesityaction.org. And they do a lot of work with weight bias, stigma, treatment, legislation, so many things related to obesity as a disease. But one of the first campaigns they had was the Your Weight Matters toolkit. And basically you can go to their website, obesityaction.org, and download this toolkit, print it out, and they have lots of questions for you to discuss with your doctor. Talking about telling them your weight history. I ask everyone to draw their weight history when they come in, telling your weight history, what your concerns are about your weight, if it's medical or not, if it's a way that you feel or a fear of getting some other disease down the road, and then specific questions to ask are really in that toolkit. As far as asking for labs, I think everyone should get the labs you normally should get every year.
Right.
And those include normally your thyroid, your A1C, your lipids, your kidney, liver function tests. But those being normal does not mean you can't treat the weight condition.
Yeah.
So I often tell patients, I will check your labs.
Interesting. Yeah.
I'll see if there's anything I need to treat to help you lose weight. But if they're normal, that doesn't stop me from making a treatment plan from you.
Nice.
I hope they're normal.
Okay.
I want them to stay normal.
Yeah.
But oftentimes we don't have the etiology of the obesity, but we have the treatments.
Yeah. That makes sense. Awesome. I will get that link and see if I can put it in the show notes for our listeners or watchers. It should be in the show notes for audio and for YouTube. So we'll make sure you've got the resources that you need. Yeah. Awesome. Well, this has been a lovely conversation, everyone. And thank you so much for coming. I appreciate that. Dr. Lofton, as well as, thank you for the link.
Thank you so much.
Yes, thank you. And Jack for coming on and being so brave to share your story.
Yay, thanks, Jack.
Awesome. Well, I will exit you guys stage left, as Janine says. Here are the exits. And then we will talk behind your back after you leave. So all good things. All good things.
All right, thanks so much.
Thank you so much. Bye. Oh, yay. Oh my God, that was so good. That was so good.
Dr. Lofton
my
is the truth.
gosh.
She's the shit. She's amazing. She said all these things. I was just like, oh my God, it's fascinating. Oh yeah, I'm supposed to ask you questions. I love it.
Like typing in my notes, like some of the things that she was saying, because I had never heard them explained that way.
Yeah, I know. It was the best. I know. She's fantastic. I've been going after her for a minute.
I love
we got her. We got her.
I love the point where she said we can live in two worlds, and in fact, we need to be body positivity and wellness and weight loss need to be together to help this movement to stop obesity bias. We got to get it together.
I agree.
Yes, I agree. I love that the resource. I'll look into it, and we can probably, we'll also do for listening audience to follow us and listen. We'll put it in our link trees so that you can go and access it, and we can tell people about it when we're on our lives and stuff. Like, hey, here's a toolkit.
Yeah,
it's just such a big problem. There's just not enough obesity specialists, and it's great that we have companies like Fridays, and companies like IVEAM and Mochi and all those, right? Where it's making things more accessible. But at the end of the day, even they all can't serve 40% of America. So we have to find a way for more, because that's what we care about, right? Like the most access and the best, access possible, So I think it's all good things. Things are changing. Things are changing.
We're getting there
slowly but surely.
It is too slow, but it's movement. It's movement. Yeah.
We're getting there.
I hate we missed you like half of the thing. You were just like cycling, like you were just like this little circle. We didn't see it all. So I don't want to get any messages going, Kim, you didn't like JT talk. I did too. You just didn't stick around.
It was
sometimes I do.
It was my awesome Wi-Fi that has been doing so well. So I kind of expected something to happen.
So well. It must
Yeah.
be because you were out of town and it was like, I took a break.
Yeah, it took a break.
You know
And
what?
then, I mean, season
yeah.
1, so many JT Wi-Fi issues.
Oh,
That was,
my
it was
God.
kind of cool though.
It
I mean,
was
like
so
it's like
Where we would
good.
count, we would go 1, 2, and we would count down, and then bam, she would be right back. That was kind of fun.
Like, here
but
I
you
am.
know, mine also took a doo-doo before too.
It
so.
did. With Dr. Contessa, I took a doo-doo.
Oh, yeah.
Doo-doo. It was a really bad storm.
It
Like,
was. It was a bad storm.
freaking monsoon
Yeah.
at my house.
Yeah,
It was.
it was.
Bye-bye.
Does anybody have any non-scale victories this week?
My Rick James t-shirt.
That's a good one. What about you,
Oh,
JT?
Look at Rick.
This is a size medium sweat.
So
Oh, that's nice.
I said sweet and wet at the same time. So
That was. I like it. So sweet and what?
So
So
what?
Thank
I
you.
love it.
This is a size medium.
Love it.
Amazing.
Love it. You're so little. When I saw you in person, we were in Atlanta and your little flapper dress on. It was so teeny.
Your little Beyonce dress.
Yeah,
Yes.
you
The
know
pink one?
what? That dress, and I'm so glad that you found
It
that
was a good
picture,
dress.
Kat. And
You
to-
knew I was like, that's the one Beyonce wore when she sang with
course.
Prince.
Yeah, and I just liked it because it was pink and it had some
Yeah.
feathers. I was just like,
Sure.
oh, okay.
Me too. I'm
This
all about
is,
some
you
pink
know,
with some
cute.
feathers.
Yeah,
love it.
but I mean, this is a size medium and it's a little oversized.
Right.
Yeah, it
I
does look a
can't
little big.
believe it. I
It's so cute.
when Dr. Lofton was talking
It's
about
cute.
still it's cute.
It's cute, JT.
mean-
It's so cute.
I mean, like still going to the
Yeah.
the sections that you used to go to, or
Mhm.
going to like the websites and just automatically clicking the drop down menu for the larger sizes.
Mhm.
Yeah.
It still is somewhat of a challenge for me. I
Yeah.
never thought it would be, but it really is. But I'm doing better. I'm
Yeah.
doing better. I'm just like,
Yeah.
okay,
You're
because
getting there.
for some reason, like a medium, I just think it's going to be too small.
Yeah.
And I think that stems from when my body just started just going haywire.
Yeah.
And I
Mhm.
was wearing a size medium, and people and I remember my mom told me, Janine, I think you need to go up to a size large.
Yeah.
And
That's awful.
you know what? And I did, but
Yeah.
I was trying to hold on to the medium. You
I get
know?
it. Yeah, we all been there. You know,
Mhm.
Rick James is still here because she was hanging on to it.
Cold.
You're so right. You're so. I feel
You know?
like, well, you know what? These aren't going anywhere. So I'm just like,
No, they're here to
Girl.
stay. They're here to
Girl,
stay.
Mine have deflated. And
Mine
I had
too.
to
But
adjust
grapefruits
the
and
straps
socks.
to kind of push
Oh,
them up.
you know, speaking of which, I caught a TikTok that Dr. Angelina posted of a breast surgery. I was like, whoa.
Oh,
Ooh,
I
oh,
was
was it?
fascinated. I was like, this
I
is.
bet.
really?
I'll have to do
Yeah.
something in the general vicinity at some point, but not right now. Wait till after menopause. I don't know.
Yeah, I'm
Yeah.
My
just gonna roll
my
with it.
NSV is weird. It's that I have collarbones.
Yes.
Yes.
You can
Like-
see 'em? Yep.
Oh, yeah. Like it's not like a
Come
little,
through
it's like
collarbones.
there's like it's like a big old situation right there. I was like having a conversation, I dipped. Like I was on this FaceTime thing and I was like,
When you
What is
dip, we dip, we dip. Or
when
I
we
dip,
dip.
or-
When
when I dip,
I
we
dip, I dip, we dip. Oh, I
Something.
caught it. I caught it. Yo. I put my head up on my
when you dip, I
did
dip.
it.
we dip. Yes! Woo!
a lovely way. A
Go,
lovely way to
Kim.
end our night. It doesn't happen very often. But I
I
got
love
it.
But
Anyway,
when it does, it's so good.
it is. It's gold. I love it. All right. Well, it's been a great evening. Let's all go to sleep and stuff.
No doubt.
I love such an
You
old
gotta
lady.
eat dinner first.
Yeah. You've been like, it's been a busy day. Yeah.
You know, speaking of eating, I don't know if you know what, we can cut it out if we don't want to talk about it. But
Okay.
I bought the Prime Bites protein brownies
How
that
Oh.
have been all over TikTok. WTF.
Really?
These mofos taste like a damn buttery ass
No,
cake
they do not.
piece of cake.
Stop it. Is it good gluten in it?
Oh, dang it, Kim.
Probably.
Probably. I'm
Does
it say
sorry. Let me
wheat?
see. Hold on.
Does it say wheat?
I don't,
If it
oh,
says
wait a
says
minute.
wheat, we know.
I do have my readers in here.
Oh, your readers. Those are the cutest. They look like coffee talk. You know?
Wait.
Dr. Lofton's a
It's sweater
badass.
weather.
Oh, I don't know. Look at this
By the way.
almond flour, vegetable oil,
Well, I can't eat it then.
tapioca fiber.
Ooh, this is all trending to gluten free.
I know. Let's see, lecithin. That's and everything.
If it didn't say wheat in like the first 4 ingredients, I think
Girl,
we're
I don't
good.
think I see gluten in here.
Great.
Gluten free on the box.
What does it have like contains milk or something like that at the bottom? Because it would say contains wheat.
It contains
my
milk,
life.
eggs, soy, almond. Now listen, it does say may contain
Trace amounts.
wheat, peanut, cashew, walnut, pecan, or as we say in Georgia, pecan. But I say
Pecan.
Pecan.
I don't know. I change it up a lot. Sometimes it is definitely a pecan pie.
you know what I'll
It
do?
is not a pecan pie.
I will
It's
save
pecan.
you a bite, Kim, to make sure and see if you have any gut reaction to it. This
We'll
is the
see.
birthday cake.
We'll know if I start
Man.
to itch. I itch when I eat it. It's awful.
Take a little baby bite.
Yeah.
But oh my God, usually protein, anything
I'm excited.
tastes like a foot.
Yeah, agreed. I got to try it now.
Tastes like this.
I haven't found
Tastes
anything
like
that's
I'm
very
eating
good. Like a shoe.
So anyway, and listen, we didn't get paid to do that. I just decided to try it.
However, we are open to it. We are not above it. Reach out.
Not above this at all. But those
We're
things
fine.
are delicious.
We got a whole lane for an advertiser that wants to be a protein. We've been trying to get devotion. Nothing yet.
Ghost. Guys who make ghost protein. That stuff is great too.
Oh, okay.
But
Bless the chill.
yeah. And I also discovered Premier Protein.
What are you talking
coffee
about?
flavors. Oh, it's this. Are you talking about devotion or soul?
Oh, she picked it up and I didn't even drop it down.
I was singing Earth, Wind, and Fire. You need devotion.
Oh yeah, yes.
You didn't
She
pick it
was.
up, Kat.
I did not.
Oh
I
my
missed that
God.
one. I was
Write it down in the history books. Kat
can't
missed a
believe it.
drop.
because this cake is so good.
Yeah, I want to try it.
I
It looks
can't eat
delicious.
it because
not?
it has
Almond
almond
flour?
flour in it.
Does it have
and I'm
almond
allergic to
flour?
almonds.
Oh, that sucks. Yeah, that's
I
the only thing
know.
worse than that is being allergic to wheat. And maybe
Yeah.
peanuts. Peanuts is kind of that's a bum deal.
Peanuts is
you know?
tough.
Yeah, peanuts is tough. It's in everything. It's way worse than wheat. Yeah. Plus, anaphylactic shock and all.
Yeah. That might be something to consider.
Yeah, for sure.
I don't know.
I don't know.
Nope.
Anyway, good talk. Should we
Good
break,
talk,
team?
guys. This was
We'll
awesome.
see you next week. All right. Remember, you're not
Let me
alone,
get it. Okay.
and it's not your fault.
It's not your fault. You're not alone.
Nope.
It's not your
We will
fault.
see you next
You're not
week.
alone.
Nope,
Hasta
it's not.
la
In
pasta.
case you didn't know. Hasta la pasta. We haven't said that in forever. Hasta la
I know.
Hasta la pasta.
Bye, everybody.
Bye.